Today we're going to talk about something we all take for granted, the invisible shield that protects us every single time we take medicine. These are safeguards that, we don't really think about, but they were born from a really dramatic and frankly life-saving history.
I mean, really think about it. When you get a prescription, you trust it. You trust that what's inside that little bottle is going to help you, not hurt you. But what is that trust actually built on? Let's get into it.
See, today, our trust is backed up by this huge, powerful global system. But if you rewind the clock just over a century ago, taking a new medicine was basically a gamble, a total shot in the dark. To understand how we got from there to where we are now, we have to talk about a set of standards with a pretty simple name.
It's called Good Clinical Practice, or GCP for short. And this is the bedrock of it all. It's an international standard that makes sure that medical trials are designed and run ethically and scientifically. It's the whole reason we know the data we get is solid and, maybe most importantly, that the rights and the safety of patients are protected. But these rules weren't just dreamed up in some boardroom, they were literally written in response to terrible tragedies.
Okay, let's step back in time. Let's look at those moments of crisis that actually forced medicine to become safer for every single one of us.
So before the 1900s, it was pretty much the Wild West for medicine. There was no real federal oversight. If a company wanted to sell a product and, call it a cure, they just could. And this meant that some incredibly dangerous drugs could and did make it onto the market with absolutely zero government intervention.
And that led to a whole series of just devastating public health disasters. In 1937, a so-called medicine killed over 100 people. A few years after that, a simple mistake in manufacturing led to almost 300 deaths. And then, in the 1960s, a drug given to pregnant women resulted in a global catastrophe. Every single one of these events was a really painful lesson that ended up reshaping our laws. Let's start with that first one.
Okay, so picture this. It's 1937, and a new drug called sulfanilamide is being hailed as this amazing breakthrough for fighting infections. It came in a tablet, but to make it easier to take, especially for kids, the manufacturer decided, hey, let's sell it as a liquid elixir.
The problem was how they made it liquid. To turn that powder into a sweet, syrupy elixir, the company's chemists dissolved it in something called diethylene glycol. You probably know that chemical by another name. It's a primary component of antifreeze, a literal poison.
Their result was catastrophic. 107 people, many of them children, died in absolute agony from kidney failure after taking this medicine. The public was, of course, horrified, but the legal reality of the situation was somehow even more shocking.
And get this is the wildest part. Under the laws at the time, the FDA couldn't just pull the drug for being unsafe. The company was only charged on a technicality. They called the product an elixir, which implied it had alcohol in it, which it didn't. So they got hit with a misbranding charge. The actual deaths, they weren't technically illegal.
So this tragedy and the massive public outcry that followed became a huge turning point. It was so clear that something had to change, and this is where we start to see the first modern rules for drug safety really being forged.
The connection between the disaster and the reform was immediate. In 1938, just 1 year after the elixir sulfanilamide tragedy, the U.S. Congress passed the landmark Food, Drug, and Cosmetic Act. And this law, it changed everything.
For the very first time in American history, companies couldn't just throw a drug onto the market. Now, they were legally required to test their products for safety and submit all of that evidence to the Food and Drug Administration before it could ever be sold. This was really the birth of the modern drug approval process. But safety was only one half of the equation. In the early 1960s, the thalidomide disaster struck. A drug prescribed for morning sickness was causing thousands of devastating birth defects all over the world. In response, the U.S. passed the Kefauver-Harris Amendment, and this added another crucial requirement. Companies now had to prove not just that their drug was safe, but that it was also effective for what they said it did.
Okay, so we had rules for safety, and now we had rules for efficacy, that a drug actually works. But there was another layer that was desperately needed. How do you make sure that the research itself, the trials with actual human beings, is done ethically? This led to the creation of a whole formal ethical framework.
And that framework is really beautifully summarized in something called the Belmont Report from 1979. It all comes down to 3 core principles. First, respect for persons. That means people have to voluntarily agree to be in a study, and they have to be fully informed about what they're getting into. We call that informed consent. Second is beneficence.
which is just a fancy way of saying the potential benefits of the research have to be greater than the risks. And third, justice. The people who take on the risks of research should also be the ones who get to enjoy its benefits.
And this wasn't just a US thing. This ethical mission went global. The World Medical Association's Declaration of Helsinki, which was first adopted way back in 1964, made it crystal clear that a doctor's first duty is always to protect the health of people, and that includes people who participate in research.
So how does all this history, all these reports and laws and declarations come together? Well, it forms the very system that protects you and me, right here, right now.
So today, when a new medicine is being developed, it has to pass through all these layers of protection that are the direct result of those past failures. You've got independent review boards that have to approve the ethics of any study. You have the fundamental right to informed consent. A drug has to be proven safe before it even gets to human trials, and then it has to be proven effective before it can ever be sold. And there are super strict manufacturing rules in place to prevent the kind of contamination that caused that sulfathiazole tragedy.
And that's really the main thing to take away from all this. All the forms, the regulations, the review boards, yeah, it can seem like a lot of bureaucracy, but it's not. Every single one of those rules is a shield. It's a safeguard that was built on a painful lesson from the past, and it was designed with just one purpose: to protect our health.
So yeah, the next time you open a medicine bottle, you can feel pretty confident in the system that's behind it. But it also leaves us with a pretty big question, right? As we're moving into these incredible new frontiers, like gene editing and AI-driven drug discovery, what are the tragedies we're trying to prevent now? And what new rules, what new shields are we going to need to build for the future?